You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. With us, we have an expert on the topic, Dr. Mike Golpa. Dr. Golpa, welcome to the program.
How are you?
Now, we have an exciting show today, actually, because we have two of your patients that both, after the dental implant procedure, bit into apples.
Right.
Okay.
Well, what do? I usually videograph all the patients right after the surgery. I have them bite on an apple, so they can gain their confidence.
And why do you do that? Just to show that they're
strong?
Yeah,
just to show that it's strong and they can depend on it.
Now, in all areas of dentistry, and you're known as the go-to guy for cosmetic dentistry in Las Vegas. There's no question about that. But now the shift into dental implants, or maybe it's not a shift. You've always been focused on both?
It's not a shift. I always did dental implants, and because it's part of the, when you do full mouth reconstruction, it's always part of a full mouth reconstruction. So you have to place some implants in case there's a missing tooth. But I always give the patients the options, what would be the best options for them.
Is it more fun, the dental implant patients?
Yeah, because they are the implant patient really, you would change their lives as far as their eating, not only they're going to get a beautiful smile, but they get their function back, which they never had. If they have loose teeth, they're not going to eat everything.
Now, I've talked to an oral surgeon about this, and they say a lot could go wrong, Randy. I mean, you got to be careful who you go to.
It's very technique sensitive. It's a technique sensitive, so you really have to know where you want to go to. It's not like conventional implants that you're replacing one or two teeth. Okay, conventional implants, a lot of oral surgeons do. There are general dentists out there that do it. But this technique, which is called all-on-4.
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 What does that mean?
Meaning all the teeth's going to be screwed onto 4 implants.
Okay, so like the bottom 4 implants?
The bottom 4 implants, the top 4 implants.
That's something that's fixed.
And it's fixed. And the breakthrough, there's no sinus lift, there's no bone grafting, and patients gets the benefit to enjoy the fixed bridge right after the surgery.
And they can bite into an apple.
The next day, they can bite into anything they want.
You have to be afraid, though, when you tell a patient, okay, you have these brand new
Actually, they're more afraid than I am. So
really?
I know that thing's going to be really fixed, and I know they can bite on anything they want.
Okay, now you become the go-to guy in Las Vegas for dental implants. But what are the fears out there? Maybe that you could lay to us about dental implants.
The first fear is if there's pain involved. There's hardly any pain because it's less invasive. If you have the CT scan, if you have a surgical guide which has already been made, there's no incision, so there's no suture. We do this study, and it's so easy that we can go ahead and place the implants onto our software to see exactly what size implants. And everything is predictable. We know exactly where those implants are supposed to go, what's the density of the bone.
These aren't mini implants, are they?
No, these are not mini implants.
Do you like mini implants?
No, I'm not. I don't believe in mini implants. I look at them as a temporary implant.
You don't like them?
No.
Gimmicky, maybe?
Probably, I don't use them, but if any surgeon uses it, yeah, it would be if mini implants would be used for maybe something temporary.
Who's the typical patient, by the way? What are the age ranges?
Patients, the best candidate for all-on-4 procedures are the patients who are about to lose their teeth, or patients who have dentures for a period of 5 to 10 years. The longer they have the denture, the lesser they become the candidate for this procedure.
Okay. You say if they're healthy enough to walk into your office,
I would be able to.
You could probably get them fitted.
I would probably be able to, 95%, I would be able to give them a fixed bridge in one day.
So men and women?
It doesn't make a difference.
Half and half? Who comes in more? More women?
50-50. 50-50. Whoever who is suffering from loose teeth and they have periodontal disease, or they have denture which is not fitting right, and they don't want to have something removable, they want to have something fixed. Those are my patients.
Okay, in prepping for this interview, you said you wanted to make sure we talked about this, that there are patients that have been turned down elsewhere, that have been told you're not a candidate for dental implants.
Many dentists, they don't have the experience and the technology to perform this procedure.
So they're telling
patients that they're not the candidate because they are thinking the conventional way of placing an implant and waiting 6 months to 9 months for bone integration to take place. And not only it's costly for the patients, the healing time is much longer, and there's much more involved.
So in a perfect situation, 3-4 appointments, and they get their teeth back. Is that right?
Basically, in
In a perfect...
Two appointments.
Two appointments.
First appointment is about 2.5 hours. Second appointment about 10 minutes.
We've known each other, what, 6 months, I guess?
Right.
And the week you were coming on the show, I talked to a periodontist right here, and from Palm Desert, California. She says that it's impossible. You can't do 4 implants to secure a denture.
I hear that all the time.
You do?
hear that all the time, but more and more specialists and dentists are becoming familiar with this technology.
Good.
And
you're doing it every day, every week.
We do it every day. We do about 4 to 5 surgery every week with this typical procedure.
People are living a long time today. So for people worried about
that's true.
the
They want to
money
benefit. You know, they want to go ahead and be able to benefit their life the best that it can be. You know. So
I love your take on the recession. You say that's a good time to invest in yourself.
Right. Exactly.
It's a sure investment.
Life is too short. You know.
Okay.
So better get the best of it.
We're going to take a quick break. We come back. We're going to meet some of your patients. 2 patients that both, after the surgery, bit into an apple. This is amazing.
Exactly.
I haven't seen the tape yet.
Yeah.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. You don't want to miss. In fact, call your friends with dentures. You don't want to miss this next segment. We'll be right back.